All right, so this is the last video in the series, Stepwise Approach for Managing Asthma Long-Term by me, Nicholas Riesenberg. So assess control. The stepwise approach tailors the selection of medication to the level of asthma severity or asthma control. The stepwise approach is meant to help, not replace the clinical decision making needed to meet individual patient needs. So this is just a little bit of a help and a guide to help you determine what the patient may need in their severity and the medication to apply to that. So first step in the assess control is step up if needed. First, check medication adherence, make sure they're taking their medication properly. Inhaler technique, make sure they're doing the technique properly. Environmental control, make sure they're trying to avoid those environmental triggers and core morbidities if they have any other diseases underlying that. And then step down if possible. Asthma is well controlled and if the asthma is controlled for at least 3 months. So if it's been well in hand and controlled for 3 months, we might want to start dialing back on a little bit of that medication that they're on. So it breaks down by age groups. It goes from 0 to 4, 5 to 11, and then 12 and up. So for ages 0 to 4, step one, the preferred treatment is a SABA as needed, so a short-acting beta-2 antagonist or a bronchodilator with no alternative treatment. And this is classified as intermittent asthma. So step two would be preferred is a low dose ICS, so inhaled corticosteroid. The alternative treatment is cromolyn or montelukast. Step two and on is considered persistent asthma. So the first one is going to be step one there is in the intermittent stage, and step two through step six is going to be considered intermittent asthma, or excuse me, as persistent asthma. So with persistent asthma, it's going to require daily medication and it has no alternative treatment options. Consider a consult with an asthma specialist once you get to a patient who's at the step two range and has persistent asthma. Step three, a medium dose ICS. Consult with the asthma specialist if step three or care or higher. So at step two, you want to consider it, but once you get to step three, you need to have a consult. Step four is a medium dose ICS plus either a LABA or montelukast. Step five is a high dose ICS plus either a LABA or montelukast. And step six is a high dose ICS plus either LABA or montelukast plus oral corticosteroids. So you see with each step, something is either added medication wise or a dose is increased or both sometimes. So we're always trying to find that right level of severity that they're in and get the medications required to control that asthma. So the next age group is 5 to 11. Step one, the preferred treatment is a SABA as needed with no alternative treatment option. You'll see that a lot for step one. Step two is preferred treatment is a low dose ICS for alternative treatment, cromolyn or that leukotriene receptor antagonist or theophylline, which is a respiratory stimulant. And step two and on is considered persistent asthma and requires daily medication. So step three is the low dose ICS plus either a LABA or the LTRA or theophylline or a medium dose ICS. So you have some room to assess the individual's needs there per patient, but you have a few options there, but you're adding as you keep going. And step four, preferred treatment is a medium dose ICS plus a LABA. Alternative treatments consist of medium dose ICS plus either LTRA or a theophylline. And for steps 2 through 4, consider subcutaneous allergen immunotherapy for patients who have persistent allergic asthma. So that's another option for this next age group. Now that they're a little bit older, lung maturity is hopefully getting better and growing. You might want to consider that immunotherapy. Step 5, preferred treatment is a high dose ICS plus a LABA. Alternative treatment consists of a high dose ICS plus either the LTRA or theophylline. So a lot of the same kind of options here, just increasing those doses. Step 6 is preferred treatment is a high dose ICS plus a LABA plus oral corticosteroids. Alternative treatment consists of a high dose ICS plus LTRA or theophylline plus oral corticosteroids. So that case, you're adding that corticosteroid, that oral one as well. So yeah, as I've said, each step you're just adding a new medication or increasing the dose or both to try to control that asthma. So the last age group is 12 years or older. Step one is the SABA as needed alternative treatment. That's intermittent asthma. So same as the other previous age groups. Step two, preferred treatment is a low dose ICS. Alternative treatment consists of cromolyn, the LTRA, or the theophylline. Step three, preferred treatment is a low-dose ICS plus a LABA or a medium-dose ICS. Alternative treatment consists of low-dose ICS plus either LTRA, theophylline, or xylulin. So step 4, preferred treatment is a medium-dose ICS plus LABA. Alternative treatment consists of medium-dose ICS plus either an LTRA, theophylline, or xylulin. And again, for steps 2 through 4, you're going to consider that subcutaneous allergen immunotherapy for patients who have persistent and allergic asthma. So for step 5, high dose ICS plus a LABA, and consider, I always have trouble saying this, omalizumab. I know that's not correct, but I never can say it right. For patients who have allergies, and there's no alternative treatments to step 5. And I apologize if you hear the blowers outside. Step 6, high dose ICS plus LABA or corticosteroid, and consider omalizumab for patients who have asthma or have allergies. And 12 years and older, quick relief medications. SABA is needed for symptoms. The intensity of the treatment depends on the severity of the symptoms. Up to 3 treatments every 20 minutes is needed. Short course or oral systemic corticosteroids may be needed. So in this, you want to use some caution. Use a SABA over 2 days a week for symptom relief, not to prevent exercise-induced bronchospasm. Generally indicates inadequate control and needs step-up treatment. So if they're having to consistently use this, their asthma is not being controlled. We need to think about whether their medication technique, or if it's not a technique problem, that this is not the right dose of medication for them. So this is just a picture of all that we just broke down here together as the chart here. I couldn't find a good picture of a chart with the ages 12 and older, but this still is going to give you kind of the basic breakdown of those steps and what it looks like. You see the first 2 brackets on the left, you have children 0 to 4, and then underneath 5 to 11, and you have after that to the right preferred, and then alternative. And then the quick relief medication is also in there as well. So preferred step 1, SABA PRN for the 4 to 11, and no alternative. Step 2, low dose ICS, alternative cromulin or montelukast. Step 3, medium dose ICS, no alternative. Step 4, medium dose ICS plus either LABA or montelukast. Step 5, high dose ICS plus either LABA or montelukast. Step 6, high dose ICS plus either LABA or montelukast plus an oral systemic corticosteroids, excuse me. And then you also see where it says step 1, persistent asthma underneath that, and then under step 2 through 6, you see the persistent asthma, daily medication, consult with an asthma specialist if step 3 or care is higher as needed. Consider the constellation at step 2. And then underneath you have the same thing, only different options for that that age group. The intermittent is the same, and for stage 1, it's the same as before, and the 0 to 4. And the second step 2, the preferred is the same, low dose ICS, but the alternative has a little bit more added to it. It has the LTRA, acrotomil, or the theophylline added. And then, or it says either for both of those, low dose ICS plus either LABA, LTRA, theophylline, or medium dose ICS for the step 3. Step 4, medium dose ICS plus a LABA. Alternative would be a medium dose ICS plus either LTRA or theophylline. Step 5, high dose ICS plus LABA. And then alternative high dose ICS plus either LTRA or theophylline. Step 6, high dose ICS plus LABA plus an oral systemic corticosteroid. And alternative would be a high dose ICS plus either LTRA or theophylline plus an oral systemic corticosteroid. And so that concludes my presentation with this. This was been a fun one to do, especially with me having asthma, and honestly uncontrolled asthma. I don't have any medication at this point, but it's something I'm going to do once I finish school and get under a good insurance plan and get that assessed again. But it's been good to learn about this and go over it some more, and be able to assess a little bit of myself and what my symptoms have been. I think I would fall into that exercise-induced bronchospasm, and also with the cold air. Sometimes if I get out there too quick and move around too fast, I get a little bit short of breath from that too. So this has been not only educational from an education standpoint, but educational for me personally and how to manage my own symptoms and asthma treatment. So I hope this was enjoyable for you. It's been enjoyable for me. And this will conclude this video. Thank you very much.